Hello, and thank you for joining us today. I'm Lillian Montoya, President and CEO of Christus St. Vincent. It's been a while since we last talked with you, and now we have even more information to share. The last year has been challenging for our community, reshaping the way we live, work, and play. At Christus St. Vincent, virtually every aspect of our operations has been impacted by the coronavirus, from patient care to our supply chain to our workforce and more. But for all of its challenges, the last year has also revealed extraordinary resilience, perseverance, and clinical excellence of Team CSV. From the beginning of the pandemic, Christus St. Vincent has been determined to do our best for our community, working hard to ensure our hospital remains the safest place to work and receive care, and that each of our patients receive the most advanced treatment available. This has been a year about the mobilization of resources to test for the virus, vaccinate against the virus, and care for all patients in spite of the virus. Thanks to our incredible team of providers, nurses, technicians, and associates, Christus St. Vincent has faced each challenge with confidence and determination, relying on our skills and training to lift our organization to new heights. Before I introduce today's speakers, I'd like to share a few special achievements from this past year. Christus St. Vincent earned a 5-star quality rating from the Centers for Medicare and Medicaid Services. We were recognized by U.S. News and World Report as one of New Mexico's only 2 best regional hospitals. We launched the only Phase 1 clinical cancer treatment trial program within 200 miles of Santa Fe. We opened our new Orthopedic and Sports Institute, providing comprehensive orthopedic care. We welcomed new neurologic and geriatric care providers to pursue our goal of developing a comprehensive stroke care program. We also administered more than 8,000 free flu shots to local community members, tested nearly 20,000 individuals for COVID-19, and we've already vaccinated nearly 2,500 individuals to protect them from COVID-19. We continued our clinical collaboration with the Mayo Clinic to ensure our community has access to world-leading medical expertise close to home, and we were named one of New Mexico's best places to work for the 3rd consecutive year during a pandemic. We can be so proud of our community hospital and the men and women who are so deeply dedicated to ensuring our friends, neighbors, and family members have nothing less than exceptional care. Today you'll be learning about some key aspects of the Christus St. Vincent COVID response from 4 of our leaders. Monica Leyba, Chief Nursing Officer, will discuss our new care model and multidisciplinary approach to caring for COVID patients. Dr. David Gonzalez, Chief Medical Officer, will update you on treatments and therapies Christus St. Vincent uses to save lives and help patients recover more quickly. Dr. Teresa Ronan, Medical Director of Quality, will share important statistics on COVID-19 that I call COVID-19 by the numbers in our community, and it speaks to the scale of our testing and our treatment efforts. And Kathy Armijo Itri, Vice President of Mission and Community Health, will discuss the importance of spiritual care, working with caregivers and families, diverse patient populations, and nurturing associate well-being. Thank you for watching, and thank you, Santa Fe, for your generous show of love and support for Team CSV. Your kind words, cards, the meal donations, donations of hand-sewn gowns and masks, thoughts and prayers have sustained us and helped us to do our very best work for our community throughout the pandemic. The St. Vincent Hospital Foundation and our service excellence teams stand ready to receive additional donations of love and support for our continued efforts. We are so very grateful. Be safe, be well, and take care of you.
With nursing in general, learning about the pandemic and how we were going to care for patients, we had so many nurses stepping up to say, I'm going to take care of this patient population. And with open arms, we did that at the very front end, which is our emergency department, in welcoming the patients to the organization and giving us the opportunity and privilege to take care of them. Early on in the pandemic, we learned that we were seeing the adult patient population, and it was comprised of patients that were med-surg level, so lower acuity, the moderate acuity type patient, and then the critical care level patients. So in looking at the entire workforce, we knew that we had to do nursing a little bit different. And we pulled them together and looked to the areas with greatest need, so your critical care level type nurses, and had to give them additional support in order to care for many. And that's how we built the model itself. It took us a couple of months realistically because there were lots of things that we were working in tandem with the staffing aspect. For example, the care environment that were taking care of the patient and how we were going to separate the nurses from those who were taking care of the patients and any other discipline who was supporting the nurse in caring for the patient. So we had to develop what we call our red and green zones in the areas that we have these patients segregated. The safety huddles here at Christus St. Vincent occur on a daily basis. We bring the leaders together to talk about any safety issues that were identified within the 24-hour period prior. And we manage those as a team so that we are tracking if there was a safety concern until its completion and that we've resolved the issue. So we were already meeting on a Monday through Friday basis with a check-in on the weekend with the team. And when we started to see the pandemic come to the United States, we ramped up meeting to twice daily. And initially the safety huddles involved about 20 people, and we quickly got to about 85 of us. The core team that got together to work on the pandemic and start to plan how we were going to manage patients that we really didn't know about and how many. Started with bringing the patients to the ED, and then we started to think about and what was the next level or the next phase if we got to see more and more patients. And created a small unit that was our CDU 19 where we could take up to 9 patients of all levels of care. That's your med-surg, progressive care, and critical care level patients. In that next level planning, we had the Frost Pavilion, which is a unit that has 3 separate pods of 12 beds. And once we reached the level of patients we could take care of in CDU 19, we then moved that patient population to the Frost, knowing that in that area we could expand and contract based on patient care need. We created the unit with a multidisciplinary team approach, one of nurses that took care of patients throughout the entire organization from ED, critical care, progressive care, med-surg. We had some pediatric nurses. And the rest of the care team with therapy staff, respiratory therapy, our physicians, and really managed to the level of care that the patient required. So if they were a critical care level patient, we had them in Frost 19. If we had a patient that didn't have COVID, but was a critical care level patient, we had those separated in our main ICU. So essentially we were running 2 ICUs at the same time. In addition to the critical care level patients in Frost 19, we also had med-surg level and progressive care level patients. So that's where the nurse is coming together to take care of all different levels of patients in the same environment. Was an incredible journey that nursing has been through.
Our treatments are divided between the inpatient and the outpatient setting. In the inpatient setting, when you're admitted to the hospital, our mainstays are still the Decadron, which is a steroid and helps reduce inflammation, followed by Remdesivir, which is a medication we've been using throughout this last year. And basically what that does is slows down the shedding of the virus, and we found that people have responded to that. And another therapy that we have is convalescent plasma, and that seems to be used a little less often than it was before, but it's been proven to be very safe, and its efficacy is still being investigated. On the outpatient side of things, we offer some preventative measures, and that is monoclonal antibodies. Currently, we offer 2 types of monoclonal antibodies. The first one is bamlanivimab, which we refer to as BAM, and that is given in our outpatient setting. The criteria for receiving a monoclonal antibody is you cannot be in the hospital, it's for outpatient use only, and its goal is to prevent necessity of admission to a hospital. So we've been using that very successfully, and our second product is a Regeneron product, and that combines two monoclonal antibodies. It's given in the same fashion. If you test positive for COVID virus, then you may qualify to have a monoclonal antibody. And the criteria we're using is if it's within 6 to 10 days of your symptoms beginning or of receiving a positive test. You may qualify if you're over age 55 and have certain conditions such as autoimmune disease, chronic obstructive pulmonary disease, coronary artery disease, and we encourage you to talk to your primary care physician to see if you qualify for that once you've been diagnosed with COVID. It may help keep you out of the hospital and reduce your symptoms. We've been at the forefront of using these new modalities once they've been approved. Both remdesivir and the monoclonal antibodies have received extended use authorization by the Food and Drug Administration, which means that we're able to use them and use them quickly. So we've been using them very safely throughout the summer and now into the fall and winter. We were actually using a lot of remdesivir in the early days when our hospitalizations were at their highest. And now we're using a significant amount of monoclonal antibodies to help keep people out of the hospital and relieve their symptoms. I'd like to speak a little bit about quality. I'd like everyone to know that the quality, we're still keeping very close tabs on it, something that we've been doing for several years now. Coming to Christus St. Vincent Hospital is probably the safest place you can go. Everyone that enters the building is monitored on a daily basis for symptoms of COVID, as well as having their temperature taken. We have safety huddles on a daily basis. We also have what's called peer-based review team. It's a group of about 10 to 12 experts within our medical community here who have been meeting daily since March. And basically we set the standards for everything from personal protective equipment to contact tracing to surveillance to following people who've had COVID, to medication administration such as BAM, which I've talked about before, as well as remdesivir. So this is probably the safest place you can be. We have not dropped the ball on looking at all the quality indicators that gave us our 5-star rating. I would like to encourage everyone to get vaccinated for COVID-19. I think that's the best way we can protect ourselves and our families and our community. It's a safe vaccine. It's been proven to be very efficacious, and it'll help us get a handle on this pandemic.
I'm Teresa Ronan. I am the Medical Director of Quality here at Christus St. Vincent. I work with a very ambitious team who does robust data collection and analysis and establishes relationships with frontline clinicians to ensure that all of our patients at Christus St. Vincent receive high quality health care. We have tested over 19,000 individuals in our community for COVID-19. Unfortunately, more than 2,200 of them have tested positive within our organization. And sadly, we have seen 58 patients die of complications related to the coronavirus. The vast majority of those patients that have passed have had comorbidities such as cardiovascular disease, underlying lung disease, diabetes, and obesity. Our highest number of coronavirus cases was the week of November 16th. This week, we had more than 330 individuals test positive for the virus. December 21st, a little over 70 individuals tested positive for the virus that week. We had, at our maximum, in late November, 42 patients being cared for in our Frost 19, which is our COVID-19 unit. And today, the census is 29. And while we see our numbers declining, our guard is still up here at the hospital. We continue to screen every patient that comes through our doors for signs and symptoms of We continue to cohort patients that have the coronavirus on a separate unit known as FROST 19. We continue to be diligent in our mask use. In fact, we have a universal mask policy here at the hospital, and we're diligent in our hand hygiene and social distancing measures. And finally, we have ample PPE for all of our healthcare workers. I encourage everyone to stay home whenever possible, and when that's not possible, continue to wear your mask while in public, be diligent in your hand hygiene, maintain a distance of 6 feet or more, and if you are offered the coronavirus vaccine, I encourage you to receive it.
Here at Christus St. Vincent, we're committed to holistic care, and that means care of the mind, body, and soul. In the COVID environment, we've been stretched with how to do that because we've had to do it in very different ways. So we've established a patient-family action team. And what we do is designate a staff person to be the point person for every family. And they maintain contact with them and they help facilitate video calls. Oftentimes, if a patient is placed on a ventilator, they may not have seen them. The patient can't communicate, so we're able to at least show them their family member. And we also help with the spiritual aspect of healing as well. Over this experience, we've been caring for a lot of Native Americans as the central hub hospital. We've been involved in caring for patients that have come from the Navajo Nation. Initially, that was our largest patient group. And we've learned the healing practices amongst the Navajo Nation, including how to accompany families at the time of death, and have done so with our local pueblos as well. We honor all spiritual beliefs, and so clearly, our Catholic patients, our Jewish patients, our spiritual care team is in charge of coordinating all of the contact with family members and with the patients themselves. So when a patient is conscious, is not on a ventilator, then we're able to have a direct conversation with them on the phone, of course, and learn about what it is that they would like. And so, prayer groups have been organized, and whatever it is that the family wants, whatever it is that the patient wants, we've been able to do. We do find it very important to connect with the families and find out what an individual patient's spiritual preferences are and make sure that we are able to honor them to the best of our ability. We've been able to do things like perform Native American healing ceremonies, not within the patient room, so we've had to modify and have done things outdoors or near the patient's room. So I feel as though the work we've been able to do through caring for our patients with COVID has really kept our work sacred, and it's kept healing sacred. So I'm very proud of what we've been able to do and how we've been able to help. It has also been our responsibility to, it's actually everyone's responsibility to be concerned about associate well-being. And so we've taken a number of steps to do things like we hold regular listening sessions, because we know that when people are in an extremely traumatic situation, that the opportunity to debrief and talk about it and talk about their fears, talk about how it is affecting them physically, how it's impacting their sleep. So we hold regular listening sessions. If there's one message I can give to any of us who have remained COVID-free, we're so fortunate. And I don't know about you, but I just thank my lucky stars and thank the heavens every morning that I wake up healthy. But it is never too late to make your decisions. Making our advanced care decisions for all of us is a really important thing because you don't know. And if you are someone that has something happen that requires you to be on a ventilator, you really need to think that through to make a choice whether that's something you would want or not. And it is very difficult on family members to make those choices for their loved ones because they don't want to. And it's totally understandable. I just feel so very proud of the care we've been able to provide. It's really personal for us. You know, I have multiple friends, childhood friends, whose family members have been in the hospital over the last few months. And the way that we do things really matters because those are my family as well. I grew up with them. And so I'm extremely proud of, you know, how we've done the therapeutics, how we have managed our ethics process, how we have been able to maintain connection with family members and really know our patients behind the mask, under the ventilator, know who they are, know what makes them happy, know what they would want out of life. That to me makes my day feel complete.